Hi everyone. Well, I don't think anyone could have truly imagined what the last few weeks were going to be like in terms of the sharp increase in patient numbers with COVID. We always knew that January was going to be a hard month, but that's a massive understatement as we've gone from around 80 patients with COVID before Christmas and now mid-January we are treating around 400. I'm so proud to work for this trust, which has responded so well in the way that it has. Everyone's pulled together with such an amazing effort. There's been lots of planning to do, everything about ensuring that we have enough supplies, to reconfigure in our hospitals to make sure that we've got enough green and blue pathways so that we can look after our patients as they come in and protect our patients and staff equally. Thank you so much to everyone who's just done so much around this. I know how tired everybody is, I know how draining the experience has been, but you should be really proud of yourselves. And please do remember all the support that we have on offer and seek help at any time. And of course we've been working very closely with all our partners throughout this period because no hospital could rise to this sort of challenge on its own. Earlier this month we were really pleased to learn that a number of MOD service personnel were going to be released to support trusts across the South West. I'd like to add a special message this week to our shielding staff, many of whom have actually been at home for quite a long period of time now. I know that you find it really frustrating not to be at work, and it can be very isolating being at home, but please be assured that we know how much you're doing to support your colleagues. There are also large numbers of staff who are isolating at home or perhaps symptomatic with COVID, and I want to wish all of you the very best as well. It's not easy being stuck at home, but we all have to do our bit to follow the national guidelines, and so I just want to say thank you for all you're doing to help protect our patients and for us to protect each other. Now, one of the ways in which we can help our staff to get back to work is through the swabbing that we now do on site. So we can be absolutely clear then as to whether or not people are COVID positive or not. Our swabbing teams have been amazing, standing outside in all weathers, helping their colleagues and others by carrying out large numbers of these tests. And of course, over the past few weeks with the surge, those numbers have gone really high indeed. Thanks so much to all of these swabbing teams. They are so good and so really dedicated, and we really appreciate what you do. Another way in which we can better protect ourselves and our patients is through the lateral flow tests that of course now staff are able to self-administer. I was really pleased to learn this week that we've received another big delivery, and this means that all staff, clinical and non-clinical, patient-facing and office-based, will have access to these kits. Do make sure that you have one and that you're testing regularly, and also that you record the results so that we can spot any areas of concern. And of course the most wonderful development this month has been the rollout of the new vaccine. We started doing this at very short notice and in the middle of the Christmas period, but with monumental effort on the part of lots of different staff groups, we have made incredible progress. We've already vaccinated enormous numbers of staff, as well as the care home staff that have been coming on site to receive their vaccine. And we've been able to offer it to all the priority groups within the trust. This means that the vaccines are now available for all staff working within all our hospitals. We've set up an online booking system so you can access this directly. Just make sure that you've booked your slot. We really have achieved so much in a very short space of time, so an enormous congratulations to all those involved, to the jabbers themselves, to the pharmacists, to our admin staff and all those who've been supporting the clinics. Of course, a big thank you to our HR team and our IT colleagues who've absolutely made sure that all this has happened. So many people have been involved, and we've only been able to make it happen as always by working together as a team. Meanwhile, while the Trust has of course been working so hard to cope with the sharp rise in COVID patients, we've had to take the very difficult decision to cancel routine elective surgery and of course some of our outpatient clinics. Only in this way have we been able to move the staff to support the surge in demand. Now we know what a difference these operations and treatments make to everyone's lives, but I hope that people understand we really don't take these decisions lightly. I'm glad that we are able to continue so much work through appointments online and by embracing the new technology, but there's no doubt that these latest cancellations are going to have a big impact on waiting times. Please be assured that we continue to prioritise the most clinically urgent patients and that we're constantly monitoring the situation. We should be resuming our normal services as soon as we can, once the pressures are off our staff and when we know that it's safe for us to do so. So it's certainly been a baptism of fire for University Hospitals Dorset since we came into being on the 1st of October. Never before have our hospitals been under so much pressure. But I'm really glad that as one trust, we've been better able to support each other, and this has been in a way like never before. We're sharing resources to react to every situation, and together we will get through this. The infection rates are going to reduce. The number of hospital admissions will be going down. And of course, over time, as the vaccine rolls out, things will start to go back to normal. So in the meantime, thanks again for all that you're doing. Please look after yourselves, look after your patients, but of course, look after each other. Take care.